Your family arrives at 10 a.m. with coffee and a smile, expecting to find you resting comfortably after a peaceful night in the hospital. What they don't realize is that you've already been awake for hours, poked, prodded, bled, repositioned, medicated, and subjected to procedures that have left you exhausted before they even walk through the door. And hospitals do this deliberately, systematically, and before anyone outside the medical team can witness what's really happening to your body. The moment shift change happens at 7 a.m., hospitals transform into controlled chaos that families never see. Night shift is leaving, day shift is arriving, and there's a window of time, roughly 6 to 9 a.m., when hospitals do the most aggressive and sometimes uncomfortable things to patients' bodies because it's before visiting hours and before anyone's watching. The first thing hospitals do to your body before visiting hours is draw blood. Lots of blood. Multiple vials. Morning labs are standard, checking your blood count, kidney function, liver function, blood sugar, electrolytes, whatever your condition requires. But here's what patients don't realize. They're drawing this blood at 6 a.m. when you're groggy, when your veins are harder to access because you haven't had fluids, when you're least prepared and least able to advocate for yourself. Here's what happens. A phlebotomist comes in, wakes you up, sticks you multiple times if your veins are difficult, collects 7 or 8 vials of blood, and leaves. You're awake now, your arm hurts, you have bruises forming, and you're exhausted. By the time your family arrives 4 hours later, the bruising is obvious, but you're used to it and the initial discomfort has faded. Your family sees bruised arms, but you downplay it. They just needed to check some things. What you don't tell them is how many times the needle went in, how painful it was, how violated you felt being stuck multiple times while groggy and unable to really advocate. The second thing hospitals do to your body before visiting hours is perform aggressive repositioning for pressure ulcer prevention. You've been lying in one position all night. Pressure ulcers, bed sores, can develop in as little as 2 hours of continuous pressure. Hospitals know this, so they aggressively reposition patients every 2 hours overnight and first thing in the morning. This means nurses come in early, roll you from side to back to other side, adjust pillows, check your skin for any signs of breakdown. This repositioning is medically necessary, but it's uncomfortable and disruptive. You're being rolled around like a sack of potatoes while you're barely awake. Your joints hurt. Your surgical incisions pull. If you have lines or tubes, they get tangled during repositioning. You're left sore and exhausted before breakfast arrives. Your family arrives later to find you tired and asks, "Did you sleep well?" You say sort of, because what you don't mention is the hourly repositioning that kept you from real sleep. The third thing hospitals do to your body before visiting hours is aggressive medication administration on a strict schedule. Hospitals don't give medications whenever it's convenient. They're given at specific times, 6 a.m., 9 a.m., 12 p.m., 3 p.m., 6 p.m., 9 p.m. This means you're awakened at 6 a.m. to take medications even if you were finally sleeping. Some of these medications make you drowsy. Some make you nauseous. Some have other side effects that hit within an hour of taking them. Here's what's strategic about this timing. Medications are given early enough that by the time your family arrives, the worst side effects have passed and you're starting to feel more alert. You appear more functional than you actually feel most of the morning. Your family thinks you're doing better than you are because they're seeing you at the time of day when medications are wearing off and you're becoming more alert. The fourth thing hospitals do to your body before visiting hours is perform wound care and dressing changes. If you had surgery, your incision needs to be checked, cleaned, potentially drained, and redressed daily. This often happens first thing in the morning because it needs to be done when staffing is highest and before the wound can be exposed to more bacteria throughout the day. Here's what this is like. Nurses come in, remove your bandages, expose your fresh surgical wound, clean it potentially with solutions that sting, assess for infection or complications, possibly drain fluid, and redress it. This is uncomfortable, sometimes painful, and deeply unpleasant to experience while you're groggy and defenseless. By the time your family arrives, the dressing is fresh and clean, and they don't see the raw wound or the process. You're left with the memory of the discomfort, but you've recovered somewhat, so you minimize it when your family asks how you're feeling. The fifth thing hospitals do to your body before visiting hours is perform aggressive vital sign monitoring and assessment. Your blood pressure, heart rate, oxygen saturation, temperature, and respiratory rate are being checked at 6 a.m., 8 a.m., and sometimes 9 a.m. before any visiting happens. Nurses are assessing your overall status, looking for changes, checking your mental alertness, assessing your pain, evaluating your breathing. Here's what this means. You're being examined multiple times before 10 a.m. when your family arrives. You're being asked repeatedly how you're feeling, what your pain level is, whether you need anything. This constant assessment is exhausting. You're barely conscious for the first one, and by the third assessment, you're irritated and want to be left alone. Then your family arrives and you're expected to be chatty and engaged, but you're actually depleted from hours of assessments and interventions. If you're learning what really happens to your body in hospitals before anyone's watching, hit subscribe. We're exposing the morning routines that exhaust patients before families arrive. The sixth thing hospitals do to your body before visiting hours is administer bowel medications and manage bathroom needs aggressively. Post-surgical patients and immobilized patients are at risk for constipation. Hospitals start bowel regimens immediately, stool softeners, laxatives, suppositories, to ensure patients can have bowel movements. This means you might be on a toilet at 7 a.m., struggling with the indignity of needing help with bathroom functions while you're barely awake. Here's what this does psychologically. It's humiliating. You're being assisted with bodily functions while groggy and vulnerable. You're in pain from surgery trying to use a bedside commode or toilet with a nurse standing nearby. By the time your family arrives, you've already experienced the most vulnerable, embarrassing moment of your day. You've been exposed and helped with intimate functions, and now you're expected to have a normal conversation. The seventh thing hospitals do to your body before visiting hours is perform physical or occupational therapy assessments and sometimes early therapy. If you had surgery or have mobility issues, therapy starts early. Physical therapists come in at 7 or 8 a.m. to assess your mobility, your pain with movement, your ability to walk or transfer. This might involve being stood up when you're dizzy, being asked to walk when it's painful, being stretched when you're sore. Here's why. Therapy needs to happen, but it's uncomfortable. You're being pushed to move your body when everything hurts. You're being assessed for capability when you're at your worst, early morning, post-operative, medicated, exhausted. By the time your family arrives, you've already had your therapy session, and you're more fatigued, more sore, and more discouraged about your recovery than you were the night before. The eighth thing hospitals do to your body before visiting hours is perform specialist consultations and procedures without family present. Cardiologists come by for EKG interpretation. Surgeons come by for post-operative assessment. Infectious disease specialists assess infections. These consultations happen in the early morning when specialists make rounds. You're not always fully awake. You don't always remember what was said. There's no family there to help you understand or to advocate if the specialist recommends something concerning. Here's what this creates: information gaps. Specialists tell you things while you're groggy. They make recommendations. They assess you. By the time your family arrives, you might not remember the conversation clearly. You might be anxious about what was said, but unsure of the details. Your family has to piece together information from your fragmented recollection and whatever documentation they can access. Before visiting hours end, here's what else is happening to your body that families don't see. Medication side effects are hitting. You're exhausted from being awakened multiple times. Your pain is increasing as early morning medication doses wear off. You're dehydrated from not having fluids. You're psychologically depleted from vulnerable procedures and assessments. You're anxious about information you receive from specialists. You're sore from physical therapy or repositioning. Your mood has declined through the morning. Then your family arrives at 10 a.m. expecting to find someone resting and recovering. Instead, they find someone exhausted, in pain, emotionally depleted, covered in bruises, and barely able to engage. But they don't know why, because they didn't see the morning gauntlet you've already endured. Here's what hospitals could do differently, but don't. They could schedule some procedures and assessments during afternoon hours when families are there. They could inform families about the morning routines and what to expect. They could be gentler about early morning labs and procedures. They could space out interventions instead of clustering them in a 2-hour window. But they don't, because hospitals operate on efficiency. Early morning is when the most staff is available. Early morning is when shifts change and documentation needs to be completed. Early morning is when they can do the most to the most patients most efficiently. What hospitals do to your body before visiting hours is a systematic, aggressive program of assessment, intervention, medication, and therapy that leaves you exhausted and vulnerable before anyone outside the medical team can see what's happening. Blood draws, repositioning, medications, wound care, vital signs, bowel management, therapy, and specialist consultations, all before 10 a.m., all before your family arrives, all before anyone can advocate for you or see what's really being done to your body in the name of recovery. Your family thinks you're resting overnight. What's actually happening is hours of controlled chaos that transforms your body and your emotional state before sunrise. Understanding this means managing expectations when your family arrives. You're not rested, you're depleted. You're not comfortable, you're sore. You're not in good spirits, you're overwhelmed. The difference between who you are at 6 a.m. after the medical gauntlet and who you are at 10 a.m. when your family arrives isn't recovery. It's adaptation and medication wearing off. The real you in the hospital is the exhausted, vulnerable, poked and prodded version that nobody sees because it happens before visiting hours begin.